I'm Dr. Dave Janda. Welcome back to our ongoing Operation Freedom Health series on your wellness and your empowerment. You know, Peter and I have been doing this for over a couple years. And I must say, the deep state tentacles, big pharma, big insurance, big medicine, such as the AMA, big government types, they have been none too pleased. Oh, big tech too. Let's throw that in. And big media. None too pleased about this series that Peter and I have done that focuses on your health and your wellness. And the reason is because what Peter and I educate you about is how you can empower yourselves for your health and for your wellness, as opposed to empowering big pharma with the garbage they want you to consume, big insurance with the ever-increasing premiums they want you to pay, big medicine that actually is very tight with big pharma and big insurance. There's just like this money grab going between the two, one pocket into the other, right? Big government, they want to control you. They don't want you to have any kind of control over your own life. And if you think, and I can't say the word, if you think this whole thing of the last 2 years was about no, this was about control and stripping you of your freedom and your liberty and the control you have on your life, and in particular, your healthcare freedom. And that's what this has been about for the past 2 years. And if you don't believe that's correct, just listen to the things that are being said by this whatever in the White House, or with Macron, the president of France, said just the other day. He stated his goal was to piss off and piss on every person that didn't get their medical intervention right. I suggest, Macron, go back and read about what happened in France in 1789. Don't think the aristocracy did so good in that one. But this is what Peter, Glidden, and I have dedicated our lives to, not just the past 2 years, but for decades in our work on the front line of healthcare delivery and in the research that we've been involved with. Our research is focused on prevention, preventing illness, preventing injury. And this is why we're so despised by big media, big tech, big government, big insurance, big pharma. Just look at the last video Peter and I did. And it's still up on our YouTube channel. Why are diseases skyrocketing? Oh, the powers that be hated that. The numbers were pretty good on the viewership. Actually, they were very good, in spite of those numbers being suppressed. And how do we know that? We know that based on the numbers we see on YouTube and how many people are coming to our websites. Mm-hmm. The website operationfreedomhealth.com and drglidden.com. Two sites that are focused on empowering you. So let's start 2022 off right. Today's topic is let's start off the new year right with health and weight management. Two entities that if you do it right will not empower big pharma, big insurance, big medicine, big government, or the deep state. It's my honor to welcome back my friend, Dr. Peter Glidden, who's not only an outstanding naturopathic physician, one of the top naturopathic physicians in the world, but an incredible author. 2 books that you need to have for the foundation of your medical library at home to help you. Everybody is sick, and I know why. An attempt to cure with holistic medicine. It's my honor to welcome back my friend, Peter Glidden. Pete, welcome back to the Operation Freedom Health platform.
Hey, thanks a lot, Dave. Dave, does this look swollen to you?
It is, and once again, you're about to rip through your shirt and your coat with the fact that you are just working out with your health and weight management programs, right?
You know, I was a little hesitant to want to get into the whole weight management thing, but it's the new year, and if you look at the numbers, they're crazy. Mm-hmm. A third of U.S. adults and more than a third of U.S. children are not just overweight, obese.
Mm-hmm.
And conventional physiologists they have completely the wrong frame of reference for all of this because they're brought up inside of a reductionistic framework which doesn't work here, will tell you that heart disease and type 2 diabetes and kidney malfunction are all a function of being overweight. And they're wrong.
Mm-hmm.
Those things are not caused by being overweight. Being overweight, having heart disease, having kidney problems, and having blood sugar problems are all arms of the same octopus.
Mm-hmm.
They're all caused by the same thing. It's not that if you're overweight, you're going to get all these other things. It's that if you are deficient in nutrients and you are consistently eating all of the wrong foods all of the time, you will become overweight. Your kidneys will start to fail. Your heart will start to fail, and you will have blood sugar issues, not because you have a bad gene, not because you're getting older, not because of chemtrails, not because of a voodoo curse, not because of 5G radiation, but because your body has run out of the raw materials that it needs and things start to break. Now, this is really interesting as far as weight is concerned, because that's like an easy metric to view. I mean, if someone's walking down the street, you can tell if they're obese, but you can't tell if they've got heart disease or if they've got, a kidney problem or a blood sugar problem, right? But you can tell that they're obese. So it's an easy thing to see, and just look around. I mean, just take a drive, go to the mall, go to Walmart, go to some place where lots of people are congregating. Everybody's overweight. I mean, well, not everybody, but the majority of people. It's the new norm, right?
Mm-hmm.
And it's tragic because this is one of the most fascinating things I learned from my mentorship with Wallach, Dr. Joel Wallach, 10 years ago. Talk about an aha moment. My brain exploded when I figured this out. You know who knows the key to weight loss and weight gain? You know what industry in the United States had that figured out 100 years ago?
The naturopathic physicians.
The livestock industry.
Oh, interesting.
Yeah, it's fascinating. Here's why. And remember, Dr. Wallach, before he became a naturopath,
Yeah, he was a veterinarian.
he was a vet. And he wasn't just a vet. He was extremely well-researched and well-published. And he was a luminary inside of veterinary medicine. Remember Mutual of Omaha's Wild Kingdom? Remember that TV show?
Yeah. Marlon Perkins and Jim Fowler.
Yeah, he was Marlon Perkins' vet.
Wow.
Yeah.
That's
nobody
big
knew
time.
that. Yeah. Well,
St.
Wallach,
Louis Zoo, I think, wasn't it?
that is correct.
Yeah.
Wallach did a stint in South Africa where he lived in the bush for, I think, 2 years. Don't quote me on that. At least 1 year. He was tranquilizing and saving the white rhinos from extinction.
Wow.
Yeah, it's
I didn't
an
know
amazing history. But here's what I learned from him. If you're a rancher and you're raising beef cattle,
Mm-hmm.
the more the animal weighs when you sell it, bring it to the slaughterhouse, the more money you make,
True.
right? Because it's based on the weight of the animal. But it takes about 4 years, 5 years, depending, for a beef cow to mature.
Mm-hmm.
So what do? Well, you don't want to have the animal be overweight its entire life because that will dramatically increase your overhead. So here's what the farmers do. Every time they feed the animal, in with the feed, they put minerals.
Mm-hmm.
Mineral supplement, a vitamin and a mineral supplement, but it's heavy on minerals. That way the animal's body is nutrified and mineralized.
Mm-hmm.
And when an animal's body is nutrified and mineralized, it knows when it's full and it knows when to stop eating. So the animal shows up at the grain trough, the feeding trough. It eats until it's full and then it walks away and there's more food in the trough. So the animal maintains a healthy body weight its entire life. And now 3-4 months before it's time to take the animal to the marketplace, guess what the farmer does?
Whoa, down go the minerals.
No more minerals in the food.
Right.
So in about 6 weeks, 8 weeks, the animal burns through its reserves. Now it's nutritionally deficient, especially minerally deficient. You know what happens when an animal gets minerally deficient?
It gains weight.
It eats everything.
Yeah.
Everything that it can all the time. There's a condition, actually a pathological condition in animals. It's called pica.
Right.
And it also happens in humans, but to a lesser extent. The animal will eat rocks. It'll eat dirt. It'll eat the wood on its stall because the animal's brain knows that it is minerally deficient.
It's looking for anything and everything.
It is looking for anything and everything to get those nutrients into its body. So the animal eats and eats and eats and eats and eats and eats, gains, triples its weight, doubles its weight, triples its weight in 3 months. And then the farmer takes it to auction. Bada bing, bada boom. The livestock industry knows all about weight control, weight management, and the conventional medical industry does not. And that is a tragedy of biblical proportions.
This is something that I can tell you throughout my medical school career, we never discussed. The nutritional side of it.
And see, this is the problem, man, because this is why we need a free medical market, because, you know, this information needs to be mainstream. It does. But this information is never going to be mainstream because it is not in the interests of the business model of the pharmaceutical industry. And, you know, we say it so many times, it sounds like, oh, my God, you're beating that dead horse again, not to mix metaphors. But, yeah, well, we are because it's the truth.
Right. It is the truth.
Conventional medicine, it's not healthcare, it's disease management. And the older that you get, the sicker that you get, and the more drugs that you need. And then the last 10 years of your life, it's a revolving door to the emergency room. And think about it, you know? So you're 70 years old, you've got all your hair's fallen out, you got 2 hearing aids, you've had 2 cataracts, you've got your eyes replaced, you've got dentures, you got 3 fused vertebrae, you've got 3 fake knees, right? Because one failed, and they had to give it to you twice. And you need a prescription medicine to wake up, a prescription medicine to fall asleep, a prescription medicine to pee, a prescription medicine not to pee, a prescription medicine for the anxiety, a prescription medicine for the blood pressure, a prescription medicine for the heartburn. It's good, great, fantastic for the pharmaceutical industry.
Yeah, it sure is.
Really crap for you. But inside of a medical monopoly, right, this is what passes for the best healthcare in the world, and it's not. So weight loss is easy. And I say this and people go, you know, I mean, I've always said this. It bears repeating. This whole mineral thing is the secret to weight loss. Not even Oprah knows. When you look at Oprah's career, right? She's gone up and down with weight like
very true.
8 times, right?
Right.
And so when you're in her position, and, you know, you would think that she would have access to everything, but she doesn't know about this. She doesn't know about this. You look at Oprah and see everything that she's done, and she's still overweight. So most people will think, well, it's baked into the cake. It's genetic. It's just the human experience. That's the way that it is. And I'm never, ever going to be able to recover from it because Oprah couldn't. I can't. And it's just because she didn't know this. She didn't do it correctly, which is the problem. So what do? It's super easy. You fill up your body's nutritional tank with the Healthy Foundation Pack. Let me pull that up. It's right here. It's easy breezy, lemon squeezy. Beyond Tangy Tangerine 2.5, Beyond OsteoFX, plant-derived minerals, and Prohoba Omegas if you're an adult, EFA or EFA Plus if you're a kid. I would double up on the plant-derived minerals, by the way. I would take 2 or 3 bottles of the plant-derived minerals a month if you're attempting to lose weight. You saturate your body with this stuff every day. And eventually, your body becomes replete with minerals and replete with vitamins, and you're good. And when you reach that level, your appetite decreases. Naturally, spontaneously, you don't have to even try. So before you did this, you go to Olive Garden, you scarf down 2,500 calories because you have to, and then you go home, and 3 hours later, you're hungry again.
Right.
You do this, you go to Olive Garden, eat half of what's on your plate, you're full. You take the rest home in a doggy bag, and you don't have it till lunch or dinner the next day because you're not craving it. So this is the secret. You have to saturate your body with the nutrients that it needs with an extra emphasis on minerals if you're suffering with a weight problem. And then, of course, eliminate the 12 bad foods.
So here's an interesting thing. When I started the foundation pack, right?
Yeah.
I was out at dinner after I had started it, maybe 3-4 months. I was out at dinner with my daughters, my wife and daughters. And my wife had also started on it, right? So we're at one of our favorite restaurants here in Ann Arbor, Knights, a great steakhouse. And we're eating dinner. And I've had enough. Still have half my steak there. The best half my steak. And our daughters look at us and go, you guys okay? What? You feeling okay? Yeah, what? Well, you're not eating as much. Are you not feeling well? No, we're feeling fine. Really? Are you sure?
It's amazing.
Are you sure? Yeah, fine. And, and they go, you're always, you've been taking home, like, we looked in the refrigerator and they're like some doggy bags and stuff. Little leftovers. Yeah. And frankly, Pete, at the beginning, I didn't realize until I had mentioned this to you and you said, well, that's because your nutrification is improving.
Yeah. Because the body has wisdom. The body knows what it needs. The body knows when it's had too much food. Now, here's another interesting little physiological or biochemical tidbit that I learned a little while ago, a couple of years ago. There used to be just 10 bad foods, but now there's 12 bad foods.
Right. And by the way, that video is free on our website, operationfreedomhealth.com. At the top, free. Go ahead, Pete. Sorry to interrupt.
No, it's good. Let me pull up the website here if I can multitask. Yeah, there it is, operationfreedomhealth.com. So we added corn and soy to the 10 bad food list. Now it's the 12 bad food list because guess who? The World Health Organization, about 5 years ago, published data that said if you eat genetically modified corn or soy, or corn or soy that's been grown with glyphosate, right? That your chances of 3 different types of cancer and death by stroke dramatically increase. Right? So the World Health Organization saying this. Right? So, but there's another interesting thing about corn. Corn syrup is in a lot of things.
That's right. A ton of things.
A ton.
Almost any. As you go down the grocery aisle, go down to your grocery store. Right? I did this. I thought, well, when you first said this, I thought, well, it's probably going to be a fair amount, but definitely not like almost everything. Pete, you name the aisle you go down, and you start looking at the back of a bottle or a can or a what. It's like, are you kidding me?
It's in everything.
Yeah.
Now, corn syrup, one of the ramifications of the metabolism of corn syrup in the human body is that it shuts down a biochemical pathway in the brain that lets you know that you're full. Because the brain has a circuit that turns on, you're full, your appetite stops. That circuit, the little fuse in that circuit is compromised by corn syrup. So if you're eating corn syrup, you're always hungry. Always hungry because that little circuit that tells you I'm full doesn't work anymore because of the corn syrup. And it was that revelation that was the thing that pushed me over the edge with my belief that this is all done on purpose. I believe that the food has been manufactured the way it's been manufactured on purpose to help make people sick. I believe that the way that farmers are taught to grow food has been done on purpose in order to demineralize the food and to make people sick. I think that that's happened. I think that that was a plan that was put in place by the powers that be. And, that's why the title of my first book, and I laugh whenever I hear it, everybody is sick. Man, I know why. Well, it's because everybody's eating all the wrong food all the time. Everybody is completely deficient in their nutrients, especially their minerals. And then when people develop a chronic disease, the only medicine that they have access to is disease management through pharmaceuticals. It's a perfect storm. It is a perfect collaboration. Quite frankly, it was genius. It was a stroke of genius. Whoever developed this, I mean, Goebbels would be proud of that. But that's the deal. So if you are interested in becoming healthy, which will have the side effects, by the way, of your
weight
losing
management,
weight.
of weight management, right?
Yeah.
Yeah.
People say, I want to lose weight. I say, I don't really care if you want to lose weight. I'm more interested in making you healthy, because when you're healthy, you will automatically lose weight. And, these other ways that, like Weight Watchers these are all calorie restriction strategies. And this is the ultimate thing for weight, because there wasn't anybody in Auschwitz that was overweight.
True.
Didn't matter what their nationality was, didn't matter what their sex was, didn't matter what their age was, didn't matter what their pre-existing conditions were. If you don't eat, you lose weight. The reason that people who are overweight or obese gain weight is because they eat too many calories. Why do they eat too many calories? Because they have father or mother issues? No. Because their bodies are undernutrified. Their bodies are craving nutrients in the desperate attempt to fill that tank up, but the nutrients aren't in the food. So what do? We fill the tank up. We stop eating food that's coming up the works. Eliminate everything that has corn syrup in it. And slowly but surely, like happened to you, and you don't even know it's happening. It happens so slowly.
Right. Didn't notice.
You just automatically start eating less calories. Now, once you've done this program for 8 weeks, you will lose weight. It's guaranteed. Different people lose different amounts. But after 8 weeks of this program, if you want to accelerate the weight loss, in addition to continuing to do all of this, eliminate the 12 bad foods and take the nutrients, you dial in 1,200 calories a day. Now, that's impossible to do in an undernutrified body.
There's no way. That's the key. You got to set that's why this thing called a foundation, because you got to set the foundation nutritionally with the foundation pack, and then everything else comes off of that.
100%. And that's why Weight Watchers fails.
That's right.
Because people can harness their willpower for about 90 days.
And then that's it.
To be on a restricted calorie diet. You will lose weight, but Mother Nature comes a knocking. You wake up in the middle of the night, you raid the fridge, you can't handle it anymore, and in 2 days you gain everything back plus 5 pounds. It's not, and you'll think that, oh my God, I tried. I must have a psychological problem. No. It must be me. No. Well, it is you, but it's not your brain. It's you don't have nutrients. It's that simple. So this is
meanwhile, Weight Watchers is saying, hey, well, just try the program again. Sign up for another thing, right? And you got Big Pharma sitting there going, yeah, I'll tell you what, just wait out a little bit and we got medicines to help you with this.
Oh, yeah.
Right? The whole deck is stacked against people, and it all starts with the powers that be limiting the information that empowers people so they won't need these tentacles of the deep state to make them even sicker in the long run.
You know what you should do, Dave? Nobody could do this better than you. On your platform, you should do a series on the powers that be and how they came to be. Because not everybody knows. Everybody's, heard of the Rockefellers, and they've heard of the Carnegies, and they've heard of the Rothschilds. But it's been a long time since anybody's ever walked people exactly through how all of that happened. Mm-hmm. I think people need to understand that, because it's true. This is all, Alex Jones was right about this. Mm-hmm. It's Prison Planet. All of this has been set up to make you sick and dependent on Big Pharma. Well, and I have to say this as a disclaimer. Thank God for insulin. Oh, yeah. Thank God for lidocaine. Right. Thank God for surgery when it's necessary. This is not a diatribe against Western medicine. This is a diatribe against a medical monopoly.
So there are two people. I encourage folks to use the search engine of your choice. Eustace Mullins, and G. Edward Griffin. G. Edward Griffin wrote a book called Creature from Jekyll Island. It's about how the Federal Reserve came into being and how the criminal international banking syndicate was behind that, which we're seeing the ramifications of, have for 100 years, since 1913 when it was formed. The Federal Reserve is not part of the federal government. It's not part of the executive, legislative, or judicial branches. It's a group of independent bankers that only care about themselves and want to absolutely annihilate the economic and financial freedom of every person, not just in our country, around the world. G. Edward Griffin wrote this book, The Creature from Jekyll Island, and Eustace Mullins, just Google or search engine, DuckDuckGo, whatever you want, of Eustace Mullins, Mullins, wrote a treatise, a book beforehand, and of which Creature from Jekyll Island is pretty well based on. Those two books will outline this entire criminal syndicate. And it delves into these same Rockefellers that co-opted the banking system are the entities, same year, 1913, right? Same year as the Federal Reserve, Pete, same, right? Rockefellers with Big Pharma.
Yeah, that was a turning point.
It was a huge turning point.
Huge turning point.
Right.
Most people are completely unaware of it. I mean, just think about how much money over the course of our lives we've spent, number one, in medical insurance, and number two, in taxes, federal taxes.
And,
think about how much money that is.
And think of what you've gotten in return.
Exactly.
Okay? Think of it. Yeah. How much money you have paid in taxes and how much money you have paid in health insurance, and what have you gotten for it? Which, you know, Pete, there are some people that say, well, you know, and it brings me to this because, you know, people say, well, you know, some of these nutritional supplements, well, they're expensive. Okay. Well, you get what you pay for. No, I mean, right? I mean, you've told the porta potty story about your friend in Florida who has the porta potty business and says that the Centrum Silvers, people are just pooping them out without any kind of absorption. And that's the key about what we're doing here through the products on OperationFreedomHealth.com. By the way, full disclosure, purchase of the products does support this platform. Is that the bioavailability. Speak to this, Pete, because here's the thing, Pete. I have a friend who got sick in South America with E. coli, salmonella, and a parasite. Essentially blew out their intestinal tract. Okay? Lost a lot of weight because okay, but then when they kind of got things turned around, they gained weight back and more. And the reason is because, and they were eating all the right things, okay? They bent over backwards to avoid the bad foods, right? But they still, and the key was getting nutrients into them that they could absorb,
right?
Which is where this comes in. So talk about that, Pete, because a lot of people say, well, I'm eating healthy, I'm eating all organic, I'm taking some Centrum Silver, I'm doing all the right thing, and the Centrum Silver is a lot cheaper than it's not actually in the long run. You're paying money to get nothing out of it, okay? 100%. Right? Okay, so educate our listeners, Pete, on this bioavailability issue, which is enormous.
Yeah, it's a gigantic thing because ultimately in the human body, it's not what you swallow, it's what you absorb.
Right.
Which is why when you're in the hospital, they're going to give you as many of the meds as they can intravenously.
Right.
They're going to inject, they're going to bypass the digestive tract if they can completely and get the stuff right into your bloodstream. Why is that? Because most people's digestive tracts
can't do it.
Have been compromised by decades of unwittingly eating all the wrong food.
Right.
I mean, it's like putting diesel fuel into an unleaded engine. The engine's not going to run right, and there's going to be problems because of the wrong fuel all of the time. So there's these little tissues in the small intestine called villi, and they're like little tentacles, and there are billions of them with a B. It's a lot of villi and microvilli. And the job of those tissues is to absorb nutrients into the human body, which leads to the fascinating trivia that when food is in your intestinal tract, it's outside the body. Because the intestinal tract is just a tube.
Right.
Goes from your mouth to the South Pole.
Yeah.
Food doesn't enter into the body until it absorbs through the intestinal tract and gets into the bloodstream. That happens in the small intestine through the agency of the villi. They absorb the nutrient particles and transport them into the bloodstream. By the way, that border between the outside and the inside of the body is where 80% of your immune system lives. Mm-hmm. That's where immune system central headquarters is. It's right there because the immune system is looking at what passes into the body and giving it a pass or a fail. Now, that's a conversation for another time. But because people have been unwittingly consuming all the wrong foods all the time, the villi have become compromised. I learned this again from Wallach, who did thousands of autopsies. And he told me that he could tell if somebody was healthy or not just by doing an autopsy of the small intestine, because 75% of the villi would be gone. They just wouldn't be there. A villi looks like a plush carpet when you do a dissection. Looks just like a plush carpet. But when the villi are not there, it looks like, a carpet that's in a hotel. It's just completely flat. But anyway. So because people's digestive tracts have been compromised, it's hard to absorb things. So when you swallow a hard-pressed tablet with a shellac coating on it, good luck.
Right.
You are not going to absorb it. You're lucky if your stomach acid is even strong enough to digest that. It's going to pass right through. You're not going to know it unless you're examining your poop. And who does that? Well, the Germans do that, but that's the only country that does that. It's the only society that does that. So, in order to get the good stuff in, because we're not going to do it intravenously.
No.
We have developed formulas which dramatically increase the bioavailability and the absorption of this stuff. I mean, the perfect example is the OsteoFX. That's the calcium and magnesium supplement. Mm-hmm. That stuff is over 90% bioavailable. If you go to a health food store and get a top-of-the-line calcium supplement, the Uber calcium supplement made by a nutraceutical company in Germany, right? Mm-hmm. Who's a sister of Pfizer Pharmaceutical. Right. You're lucky if it's 15% bioavailable, which means, if you do the math, that in order for you to get a 1,200 milligram recommended daily allowance of calcium into your body, right, you'd have to swallow about 35 to 40 of the capsules. Most people swallow 2 because that's what it says to do on the label.
Right.
And I can't tell you how many people have come into my office. I'll do a diagnosis, say, look, you are severely deficient in calcium.
Well, that can't be. I've been taking the calcium supplements.
100% correct.
Right.
Well, that goes to the whole absorption thing. And this is why this stuff works. And, after 33 years, I kind of have seen what works and what doesn't.
Right.
And so this is why I'm a cheerleader for this.
Oh, and by the way, Pete, when you look at the cost, there's a lot more expensive things you could prescribe.
Oh, yeah.
That don't work as effectively as this.
And if you wrote down everything that's in all of these supplements, just did a line item.
Yeah, in the 4 you have there, right? In the foundation pack. Yeah.
And then you took that list to GNC.
Yeah.
And you tried to recreate it. Mm-hmm. You would pay 2 to 3 times more than what this costs. Mm-hmm. Because it is chock full of stuff. And the bioabsorption of that stuff you would get at GNC is a fraction of what this is. 100%. So, this is, again, like never fail fudge. And it's the reason that we have so many happy customers. And honestly, one of the reasons, that therapeutics like this, it's one of the reasons my profession continues to exist. It's because you can't argue with results. Mm-hmm. And so when you put all of this together, this is exactly what you need. And the metaphor that I use is, look, if your kid wanted to learn how to play basketball and you had the choice for exactly the same money of having Michael Jordan teach him how to play basketball or having your high school basketball coach teach him, who would you go with? You'd go with Michael Jordan, right? Well, if you're trying to figure out how to properly nutrify your body, then it would be prudent for you to lean on the profession whose job it is to figure this out. And that's my medical profession. And nobody does it better than Dr. Wallach, who was the brains behind all of this. The research that went into the formulation of this stuff is legendary. It's in the Smithsonian Institution, by the way. Mm-hmm. It was the result of $25 million of research, 10 years, an unbelievable amount of autopsies. It does not get any better than this. And it doesn't matter if you believe me. What matters is results.
That's right.
So run this up the flagpole, slam the doors, kick the tires, take it out for a test drive, because you are going to love how it makes you feel.
Pete, I'd like to thank you for everything you have done, are doing, and will do. Your perseverance, dedication, and sacrifice to every person, not just of our country, but the world, has made an enormous positive difference, much to the chagrin of big pharma, big medicine, big insurance, big government, big tech, big media. But every person who has taken the time to research what you say, listen to what you said, and follow you over time has reaped the benefits of everything that you've brought to the table over a number of decades' time. And I thank you for that, Pete. Educate our listeners. Folks can get the products, OperationFreedomHealth.com, but you also have a website, drglidden.com. Educate our listeners on drglidden.com. And one more time, the books, Everybody is Sick and I Know Why, and Attempt a Cure with Holistic Medicine, are available, I believe, on your website, also on Amazon. Educate our listeners on drglidden.com, Pete.
So the easiest way to get there, because we want to make it easy, right? Mm-hmm. Go to OperationFreedomHealth.com. There's a graphic on the homepage with my picture on it. You click on that graphic, you'll be taken to my website. And on my website, I have a library of illnesses and health conditions and lots of information concerning different aspects of health. I give you the conventional medical point of view and the naturopathic point of view. I tell you what to do to get started on your journey of health recovery. It's self-help health recovery, right? That's why I did it, because there's only a handful of doctors like myself with clinical experience. There's millions of people, too many people to have private appointments with all of the time. So in order to eliminate that bottleneck, I put this information together on my website. So if you've got asthma, you go to my website, you type in asthma, you see everything that I've ever done about asthma, and it will give you a good place to start. And again, for 99 other illnesses. It's a subscription fee, month to month. In addition to the library that you get immediate access to, you also get access to 2 hours of live chat with me every week. 2 hours. We do it Monday night from 8 to 9 Central Time and Thursday morning from 11 to noon Central Time. It's an hour with me and people just like you from all around the world who are sick and tired of being sick and tired. They're sick and tired of being lied to by Big Pharma. They're sick and tired of being taken advantage of by their medical insurance companies. They're sick and tired of getting sicker the older that they get. And they're looking for science-based, clinically verified alternatives, and that's what I talk about.
Pete, I'd like to thank you for everything you have done, are doing, and will do. Again, folks, you can join us. We have the 12 Bad Foods video also on OperationFreedomHealth.com, plus the products there. Again, Pete, thank you for your time. Folks, thank you for your time. Happy New Year, and dream big and dare to fail. We look forward to seeing you next time.